Hello, everyone. My name is Michaela Marshall, and today I will be presenting on the epidemiology and control of HIV and AIDS in New York City. So just some background of New York City. It is located in northeastern United States. It also has a record high population of 8.9 million, and it comprises of five boroughs, which is Queens, Manhattan, Brooklyn, the Bronx, as well as Staten Island. So in New York City, there are many different socioeconomic disparities that exist. Some of them include very just high poverty rates, lack of access to proper healthcare, and some discrepancies in the education system. Lastly, they have an advanced healthcare system, which include a network of hospitals, clinics, as well as community health centers. So just some background of HIV and AIDS in New York City. So back in 1980s, there was a sudden surge of AIDS cases in New York City. And before research was done, many people just didn't know what the disease was. And once it was identified, thousands of cases have been reported and that it was AIDS and new risk groups have been recognized. So this included men that have sex with men, heterosexuals, as well as newborns through mother and child transmission. So as cases continue to rise, there were advancement, treatment, and prevention strategies that had emerged. And this included highly active antiretroviral therapy, also known as HAART. And currently, New York City has one of the highest rates of HIV in the United States, with over 1,500 individuals that have been newly diagnosed. So here we have a table that shows New York City statistics. And here you can see in 1981, the AIDS diagnosis, there was only about 165 people that had been diagnosed and about 74 deaths. And then we go to about 2019, we can see that numbers have increased significantly. And there has been 186,000 cumulative AIDS diagnoses, as well as over 116,000 deaths in 2019 in New York City. So New York City does have several modes of surveillances that they use. So first, I wanted to introduce the New York City Department of Health and Mental Hygiene. And their purpose is to just continue to address issues and protect the overall health of all New Yorkers. We also have continuing dashboards, also known as CCDs, and their purpose is to monitor essential metrics, evaluate the impact of HIV programs, and guide public health strategies. They also have behavioral surveillance, which focuses on collecting data on behaviors that can increase the risk of HIV transmission. And lastly, both of these modes of surveillance, the continuing dashboards and behavioral surveillance, are primarily operated in urban settings and targeted populations at high risk. So going more into epidemiology of AIDS, of HIV and AIDS in New York City. So in 2017, the city was ranked fourth in the United States for HIV diagnosis, and that was approximately 2,769 cases. It was also ranked ninth in new HIV diagnosis per 100,000 people, and that was a rate of 13.7%. And the demographics included males, young adults ranges 20 to 29 that had accounted for like higher percentages of the disease. And here I have listed that males had a 78.4% and young adults had a 33.8%. And also in 2021, the highest transmission categories was men who have sex with men, with approximately 46.9 cases. So here in this chart, we show the percentage of deaths that have been related to HIV and AIDS by gender. So here we can see men had a very high rate of 71.5%. Women had a 27%, transgender women had 1.6%, and transgender men had 0% in 2021. And then here we have percentage of deaths related to HIV and AIDS by race or ethnicity. And we can see that Blacks or African Americans had the highest rate of 51.1%. Latinos and Hispanics had a 30.6%. Whites had 60.4%. Asian/Pacific Islander 1.2%. And then Native American had 0.2%, multiracial 0.5%, and unknown 0%. So some implemented preventative measures that NYC had. So in 2017, the Department of Health and Mental Hygiene established NYC Condom, and the goal of this was to promote safe sex practices and reduce the transmission of HIV. There was also a needle exchange program, which lowers the transmission of the virus through contaminated needles. And there was also measures that were used to help promote the use of pre-exposure prophylaxis, also known as PrEP. And this is the daily medicine that is used to prevent HIV infection if the HIV negative person comes into contact with the HIV positive individual. So some barriers that have been faced by NYC in the HIV/AIDS control. There was an article that basically showed that these barriers can be categorized into 3 domains. So the first domain is system factors, which could include issues within healthcare where many individuals feel that they are not listened to or respected by their providers. Also social factors where the stigma significantly impacts individuals, as well as individual factors. So for some people, life stressors can take precedence over HIV needs. So my overall assessment of the effectiveness of NYC efforts to control the outbreak, overall significant strides have been made throughout New York City to control the HIV and AIDS epidemic. New York City condom and needle change program are used, and they're definitely pivotal in minimizing transmission rates. But there are still overall so many areas that need improvement, such as barriers, including socioeconomic disparities that still may need to be addressed. And it is important to overall continuously adapt and enhance programs that targets HIV/AIDS. And this will ensure that all communities have an equal opportunity to benefit from the city's initiatives. So a prevention strategy that could be implemented to control the epidemic that I just came up with is an HIV telehealth program. And this could be used to help utilize digital platforms to provide access to essential HIV services. This would overall incorporate a mobile app and website where patients can access educational resources and have a virtual consultation with healthcare providers. Services for PrEP prescriptions and follow-up will also be included in this telehealth program, and this will ensure continuous care and support for patients. And lastly, this strategy will utilize telehealth to help overcome barriers such as stigma and limited access to healthcare. So thank you for listening to my presentation. I hope you learn more about the epidemiology and the control of HIV and AIDS in New York City. And these are my references. Thank you so much for listening.